Welcome to the Department of Hematology and Oncology at Central Maine Medical Center. The purpose of this video is to show you what to expect during treatment so you and your caregivers are comfortable here and can get the most out of our facilities. The details you'll need, like phone numbers, are in the notebook you'll receive, so don't worry about writing down that information now. As you go through your treatment, you're likely to have many questions. You're never bothering us. It's our job to help you, and we hope you'll bring up any concerns, from the smallest ups and downs of how you feel to how to pay for treatment. We want to hear from you. First off, many people wonder what our name means. Hematology focuses on the treatment of blood disorders. Oncology focuses on the treatment of cancer. Our physicians are board certified, which means they've had extensive extra training and passed national examinations in hematology and oncology. But your team here is bigger than you think. Not only are we physicians, nurse practitioners, and nurses, but also additional technical staff like a designated pharmacist. And we have our own lab. We're also social workers and patient service representatives and financial counselors to help with any part of your life affected by your diagnosis. What can you expect when you visit us? When you arrive, you'll check in to make sure all of your information is current. Please report any change in address or phone number so we can reach you if necessary. Also, bring your insurance information. You'll be asked to pay your insurance copay at the time of your visit. If you can't make this payment, please talk to our financial counselors. It's easy for us to help you, and we don't want you to ever delay treatment or miss a visit for financial reasons. During your visit to the office, you'll be interviewed by our clinical staff to gather information about how you're feeling. Always bring a current list of your medications to your appointment. It's possible we may draw blood to help gather information about your condition. A physician will evaluate all your information, discuss your diagnosis, and work with you to form a plan of care. At regular intervals, you'll visit a provider to see how you feel, manage symptoms or side effects, and make sure the plan of care is still right for you. We can't emphasize enough that your treatment will be very individualized. You may seem to have the same diagnosis as someone else, but your overall health or details of your diagnosis may make the treatment suggested for you different from someone else's. What kind of treatment can you expect? Doctors often prescribe what is known as chemotherapy. This means using one or several types of chemicals to specifically counteract certain types of cancer. Because these medicines can have side effects, treatments to help manage those side effects are also prescribed. You'll receive your chemotherapy in our infusion center. Here we also give hydration, blood transfusions, antibiotics, and many other treatments. The infusion center is located right next to our offices and has a comfortable atmosphere where you can watch television, read, or rest. There are reclining chairs as well as beds, and light snacks and beverages are available. The nursing staff, who are specially trained and certified in oncology, will assess how you're feeling and give you your treatments. Our pharmacist and pharmacy staff are also specialists and can explain oncology medicines and how to manage possible side effects. In between your visits, we still want to hear from you with any questions or concerns. We can't help you unless you tell us that you're not feeling well. If the medicine or advice we have given you isn't helping, please call our office at any time. The following information is in your notebook, but to explain, when you call our office number during regular business hours, you'll hear a list of options. This may seem complicated, but it means you'll get to the right person to help you right away. Press 1 for office appointments in hematology oncology. Press 2 for prescription refills. Press 3 to speak to a nurse, or press 4 for appointments in the infusion center. If you're calling after 5 p.m. or on the weekend, you still dial the same number. The answering service will take your phone number and a brief message, and a physician will return your call as soon as possible. When you call for prescription refills, you'll press that number 2 option. You'll be prompted to leave information including your name, date of birth, your physician's name, your medication including dose and instructions, what pharmacy you would like to use, and a phone number so we can reach you with any questions. You must allow at least 48 hours for a prescription to be refilled, so please try to plan ahead so you can make your request during regular business hours. Remember, the state law requires that many pain medicines called narcotics cannot be phoned or faxed to the pharmacy. You'll have to pick up a paper copy of the prescription from our office. If you aren't feeling well or have questions, you'll want to press option 3 to speak to the nurse. During regular hours, a nurse will ask you some questions and take your information. The nurse will discuss the situation with a physician or nurse practitioner and then return your call to let you know what you should do. If you need to cancel an appointment in either the office or the infusion center, please give us as much notice as possible so we can offer your spot to someone else who may need it. We certainly don't expect you to drive in unsafe conditions. If the weather is bad, kindly call and we'll schedule your appointment as soon as possible. There are several other services we offer that may be included in your treatment here. CMMC offers research opportunities for interested and eligible patients. We are affiliated with top research facilities, so if we don't have a clinical trial available, we may be able to look for other trials throughout the region or even the country. Of course, clinical research is voluntary and may not be right for everyone. If you're interested, your doctor can make suggestions or you can contact the Oncology Clinical Research Coordinator through our offices. Another type of treatment that may be prescribed is called radiation therapy. This treatment of cancer uses high-potency X-rays targeted to a specific area of the body. Radiation therapy is administered by specially trained and certified staff at the Cynthia Ride-Home Cancer Treatment Center at the Hammond Street entrance at CMMC. Radiation therapy can be used alone or in combination with chemotherapy, so the staff in both departments work together to provide comprehensive care and monitor your treatment and any side effects. CMMC also has an oncology treatment unit, available should you need round-the-clock nursing care. Floor M1 is dedicated to the care of oncology patients. Nurses here are specially trained in oncology, pain management, and comfort care under the direction of our physicians. For the support of patients and loved ones during treatment, our oncology social workers offer a wide variety of services. They can help with practical issues, emotional concerns, and offer needed referrals. Our social workers are trained to ease communication between patients, caregivers, family, and friends. They understand and can assist with the anxiety, stress, and fear that comes with cancer diagnosis or overall prognosis. Whether emotional concerns include relationships and intimacy or support around spiritual needs, they will help or direct you to where help is available. Practical issues include assisting with advanced directives or helping you find additional resources. These might include transportation, support groups, hospice and wellness, and survivorship programs. During treatments or hospital stays, accommodations for patients or families can be set up at the Arbor House, just across the street from CMMC. Our financial counselor can assist with work and disability questions, insurance coverage issues, and help you maximize the benefits you might be eligible to receive. Whether interested in Social Security, Maine Care, or ongoing payment arrangements, please be sure to ask about financial assistance. The Patrick Dempsey Center for Cancer, Hope, and Healing is a cancer resource center right here at CMMC. It's designed to offer support, education, and wellness services to those diagnosed with cancer, as well as their caregivers. All the services are provided free of charge. In a warm, inviting environment, you can discuss your needs and make use of their cancer resource library. The Dempsey Center offers such services as transportation assistance, social support and education groups, integrative medicine workshops, and treatments such as massage, Reiki, acupuncture, and yoga. We encourage you to make the time of your treatment as easy as possible on yourself, your caregivers, and family by taking advantage of all the services we have to offer. Whether using the services of the Dempsey Center, social workers, and financial counseling, or just talking to our caring staff, We hope you'll bring your concerns and questions to our attention. We're here for you.